bowels have had surgery on them. What I've observed that anytime we open the abdomen, it typically will last 1 to 2 days, even if the bowel has not been operated on itself. Okay? Once we expose it to air, it goes on vacation. Something about seeing the sunshine makes it want to just lay on the beach, whatever it is. Okay? All right, so signs and symptoms is when we auscultate bowel sounds, there are none. And so we have to listen for a full minute on all 4 quadrants to confirm that. Sometimes they develop distension. So they literally may say, I think I'm pregnant. I didn't know that could happen because of surgery. And they may feel bloated, and they are unable to pass gas or defecate. So what do we do for these people? Well, we keep them NPO until their bowel sounds return. And, excuse me, if they have an NGE dissection, we might allow them to have a few ice chips just so their mouth stays moist, because the ice would be sucked back out with the NG tube. And then sometimes, if it's been longer than 3 days, the surgeon may have us administer metoclopramide or Reglan to help promote the return of peristalsis for that individual. All right, let me look here real quick at some things time-wise. All right, I think the pharmacology slides are pretty self-explanatory. I want to get, so I'm just going to breeze through those. I don't think there's any missing words, so you can read and study those. Oh, there's where I put the anticoagulants, wasn't it? It was on those slides. All right, so I told you that herbals can sometimes affect the patient's perioperative course, and so these are some examples. So notice how all 4 of these herbals start with the letter G, and these 4 Gs interfere with blood clotting. So if a client routinely takes these at home, there is the potential that they may have a greater than expected blood loss during the perioperative period. So we need to assess for that. And then St. John's wort and Cava can sometimes produce a prolonged sedative effect because they have a calming effect anyways for a lot of clients. And then when we add an anesthetic on top of that, it can prolong that effect. All right. And I think the rest of those we've already covered. Okay, so I'm going to switch over to the document camera. And I want you to get out a piece of paper and number 1 to 4. Put your name on the top right-hand corner. All right. Just a second here. Hopefully the document camera will work correctly today. All right. I'm going to show you some post-op vital sign graphs. Okay, so this is when you enter your vital signs in an EHR, it creates a graph that the physician can look at when he makes rounds or she makes rounds. And we're going to look at how we would interpret them. I have 4 sets, and hopefully we'll get through all 4 of them before our time is up. All right? First one. Hopefully I can zoom in.